Welcome to Pediatric Podcast for PedsCases.com.
Hi, my name is Dr. Kai Homer, and I'm a resident in radiology at the University of Alberta. This video is the fourth in a series discussing musculoskeletal radiology in children. We're going to focus on musculoskeletal injuries and go through some cases that'll help you understand how radiology fits into the whole clinical picture. In this fourth video, we're going to discuss ossification centers of the elbow. This module was reviewed by Dr. Adrienne Thompson, a pediatric radiologist at the University of Alberta. I'd like to thank the University of Alberta Department of Radiology for allowing access to images from real cases. All images have been de-identified and are used here for educational purposes only. These slides will be available at www.pedscases.com. After watching this video, the learner should be able to, number 1, list the ossification centers in the pediatric elbow. Number 2, use the crito mnemonic to recall the order in which ossification centers appear. Number 3, use knowledge of ossification centers in the pediatric elbow to recognize avulsion fractures in the pediatric elbow. So now, let's look at ossification centers of the elbow. Elbow ossification occurs at 6 centers in a predictable order as we age. Generally, the appearance and fusion of the ossification centers in girls occurs up to 2 years in age younger than boys. A commonly used mnemonic to remember the order in which the ossification centers appear is crito, C-R-I-T-O-E. In this mnemonic, C stands for capitellum, R stands for radial head, I stands for internal epicondyle, which is also known as the medial epicondyle, T stands for trochlea, O stands for olecranon, and E stands for external or lateral epicondyle. One way to remember the approximate ages at which the ossification centers appear is the odd number rule. So the capitellum would ossify at age 1, radial head would ossify at age 3, internal epicondyle at 5, and so on until the final center to appear, the external epicondyle, ossifies at age 11. In reality, that's a bit simplistic and not quite accurate, and the average ages are 1 year of age for the capitellum, 5 to 6 years of age for the radial head and medial epicondyle, 8 to 10 years of age for the trochlea and olecranon, and 11 years of age for the external or lateral epicondyle. So here, this illustration shows the ulna, radius, humerus, and the olecranon, and it shows the rough location of the capitellum in blue. Here's a radiograph to help us illustrate this. There's a tracing labeled C, which represents the capitellum ossification center. So this would be the first ossification center to form in the elbow. The second ossification center to appear is the radial head, which we see here. The third would be the internal or medial epicondyle. You can see it here with the letter I marking the internal epicondyle on this radiograph. The fourth would be the trochlea, and the fifth would be the olecranon. We see both the trochlea and olecranon ossification centers on this radiograph. Last, we have the external epicondyle seen here. So that completes the crito mnemonic. Let's do a case now. The following patient is a 14-year-old boy who comes in with pain and swelling of the left elbow after falling on an outstretched left hand. On exam, he has a visibly dislocated left elbow with decreased range of motion and tenderness to palpation. Radiographs are ordered. Is there a fracture? So here we have a lateral view of the left elbow. The first thing I'd like you to notice is that there's moderate soft tissue swelling. Thinking back to the basic densities in radiographs such as air, fluid, and bone, you'll notice that there's a lot of fluid density around this elbow, which would correspond to the clinical swelling. The next thing to notice is that the radiocapitellar and ulnotrochlear joints are aligned. The radiocapitellar joint is between the radius and capitellum. The radial head I've made blue and the capitellum is yellow. The ulnotrochlear joint is between the ulna, which I've outlined in green, and the trochlea, which is outlined in pink. One thing about elbow x-rays is that the radius and the capitellum should normally align on all views of the elbow, no matter how the x-ray is taken. So you should be able to draw a straight line through the radius and capitellum. If you pay attention to the structure that I've highlighted in blue here, we can see that there's a small linear ossific density along the lateral aspect of the radiocapitellar joint. However, there's also a small avulsion fracture off of the capitellum. So what is an avulsion fracture? It's a fracture caused by a ligament pulling off the piece of bone that the ligament attaches to, and this breaks it off from the rest of the bone. Now let's look at some CT images from that same day and the same patient. Here what we're looking at is a CT slice through the elbow. We can see the radius, the ulna, and a portion of the distal humerus. If you look here, this slice shows a defect in the cortex of the medial epicondyle of the humerus. This is the donor site for the fracture fragment that is being displaced into the elbow joint. The term donor site refers to where the piece of bone actually broke off from. Here we have a CT slice through a different plane of the patient's arm, and this slice shows a 13 millimeter fracture fragment sitting in the ulnotrochlear joint. This fragment has avulsed off of the medial epicondyle from the last slide. Because the fragment lies perfectly behind the ulna, the overlap makes it so that the avulsion fracture was not well seen on the radiograph. However, it is clearly seen on the CT. Now let's move to another CT slice in a different plane, showing the radius, ulna, and a portion of the humerus. It also shows the avulsion fracture fragment in another orientation. On this slice, we can see that some of the fracture fragments are displaced into the radiocapitellar joint. This is a 3D reconstruction made from the same CT images. On this 3D image, we're able to see the fracture fragment outlined in blue suspended in the joint space between the ulna and the humerus. Thanks for your attention, and here are some references I'd like you to go over in detail. This concludes part 4 of the video series. In the next video in this series, we'll look at injuries in the pediatric wrist. Before we leave, we wanted to leave you with a few key take-home points. Number 1, ossification occurs at 6 distinct centers in the pediatric elbow in a predictable order. Number 2, the mnemonic CRYTO can help you remember in which order the ossification centers appear. Number 3, the odd number rule can help you remember at which ages the ossification centers appear, 1, 3, 5, 7, 9, 11. Thanks for watching part 4 of the Pediatric MSK Radiograph series on PEDS cases, and please stay tuned for the rest of the series.
Check out www.pedscases.com for more great podcasts, videos, interactive cases, questions, and more. Press subscribe on iTunes to get access to all of our podcasts. If you like what we do, please leave a review on the iTunes Store, share with your friends and colleagues, or think about getting involved.